According to the National Osteoporosis Foundation's website, osteoporosis is a bone disease that occurs when the body loses too much bone, makes too little bone, or both. As a result, bones become weak and may break from a fall or, in serious cases, from sneezing or minor bumps. Osteoporosis itself means porous bone. When viewed under a microscope, healthy bone looks like a honeycomb. When osteoporosis occurs, the holes and spaces in the honeycomb are much larger than in healthy bone. Osteoporotic bones have lost density or mass and contain abnormal tissue structure. As bones become less dense, they weaken and are more likely to break. Those who are 50 years or older and have broken a bone should consider getting a bone density test. 5 signs and symptoms of osteoporosis include bone pain, a loss of height, bones that break easier than expected, stooping posture or the development of kyphosis, protruding abdomen that can result from the stooping posture and can also lead to pulmonary insufficiency and increase the risk for falls related to balance issues. 5 risk factors for osteoporosis include having a small frame. Small-framed women are actually the most at risk. Current use of tobacco products, a family history of osteoporosis, gastrointestinal diseases that can cause malabsorption such as celiac disease and alcoholism. This also ties into having an inadequate diet that is lacking in proper nutrients and calcium and vitamin D, and also an inactive and sedentary lifestyle is a risk factor. There are several interventions that can be used to prevent osteoporosis. One of the biggest ones is eating a healthy diet that has adequate amounts of calcium and vitamin D as well as calories. Exercising, specifically weight-bearing exercise, such as walking, is very important to promote bone formation. Avoiding excessive alcohol and smoking is important. Having good posture is important. And recognizing the risks and problems as well as early detection is very important. Osteoporosis is diagnosed using a DEXA scan. A DEXA scan analyzes the hips and spine, and this scan is recommended for all women that are older than 65, as well as postmenopausal women that are older than 50 and have a greater risk of osteoporosis. It's also recommended for people who have had a fracture that is thought to be the consequence of osteoporosis. The DEXA scan is analyzed and reported as a T-score, which represents and interprets the level of osteoporosis. There are many nursing interventions that can be used to help manage osteoporosis. A nurse can help to relieve a patient's pain by providing back rubs as well as applying intermittent local heat. Because constipation is a problem due to immobility and the medications that a patient may be on, it's really important to help improve a patient's bowel elimination with a high fiber diet, increased fluids, and stool softeners. The nurse can also ensure that a patient's diet is adequate with the right amounts of calcium and vitamin D. And a nurse can help assist a patient with range of motion exercises to help strengthen muscles and improve balance. A nurse can explain the importance of isometric exercise to help strengthen the trunk muscles and encourage walking, good body mechanics, and good posture. A nurse can also educate the patient on medication therapy that they are being given to help manage their osteoporosis and to also ensure that they are sticking to the regimen. A nurse can also assess a patient's home environment to eliminate any potential hazards such as scattered rugs or cluttered rooms that may lead to a fall, and they can also help to create a safer environment for the patient. Bisphosphonates work by suppressing osteoclast activity, which in turn leads to progressive increase in bone mass. A nurse should inform the patient of the benefits of weight-bearing exercises to increase bone mass, and if necessary, to explain the importance of smoking cessation and the elimination of alcohol use. It is important to stress that the tablet should be taken with 180 to 240 milliliters of water at least 30 minutes before ingesting anything else, including food, beverages, or other drugs. The patient should also be told that waiting longer than 30 minutes improves absorption. Warn the patient to not lie down for at least 30 minutes after taking the drug to facilitate the delivery to the stomach and to reduce the risk of esophageal irritation. To absorb calcium efficiently, an adequate amount of vitamin D must be present. To ensure adequate calcium intake, a calcium supplement may be prescribed for the patient. And this should be taken with meals or with a beverage that is high in vitamin C to promote absorption. The recommended daily dose should be split and not taken in a single sitting. The recommended vitamin D daily dose is 1,200 milligrams daily, and the recommended calcium is 600 to 800 units daily. There are several therapeutic procedures that can be available to manage osteoporosis. Some of them include things like a supportive mattress, a back rub, intermittent local heat. There are also 2 drugs that can be infused just a couple times a year. Prolia is infused twice yearly, and Reclast is infused just once a year. Some of the major complications of osteoporosis include limited mobility, obviously pain within the body and the bones, and also depression can result from the lack of mobility, as well as the severe pain that the patient is constantly in.